We have 38 registered, so I don't see anybody other than Rini on the call. What is happening? This is actually quite unusual. I don't think I've ever seen this happen before. Okay, here's another.
Okay, and as people begin to trickle in, it may be a good idea to get started just for the sake of time. So welcome to those of you who have not been a part of the Big Data seminar series before. I'm Dr. Ashley Hughes. I'm joined today by Craig Jarrett, and this is the second portion of our TriNetX Database Advanced Big Data webinar series. Where we have been going through different aspects and trying to highlight some things that you can do with the TriNetX database. And Craig, did you want to introduce yourself or say hi at all?
No, just hi. I'll be taking on the second half after Ashley.
Great. So to give you an overview of what we'll be discussing today, I did want to inform you about some upcoming webinars and events related to big data. We have some refreshers in terms of the terminology and how you get around, how you get access to TriNetX. We'll go over some key features that we haven't discussed yet on how to essentially work with TriNetX in their built-in analytics platform. So the specific features we'll be going over are Advanced Explore cohort, treatment pathways, and competing risks. And we do like to save some time at the end for questions and open discussion. But since it looks like we're a small group today, so please feel free to raise your hand or put any questions you may have or comments you may have in the chat as we go along. So, future big data events and webinars. So we have our second quarter webinar topic planned. We'll be covering comparison of TriNetX versus Cosmos, pros and cons of each database, sort of an ongoing discussion of the highlights for using each tool and when it might be more appropriate to select one versus the other. As a reminder, we have monthly big data office hours. Just a quick note here that we were meeting at the first Wednesday of the month, and have subsequently changed that to the last Wednesday of the month at noon. So our next monthly big data office hour will be held March 25th at noon. We hope you can join us with specific questions you might have for using either of the platforms at that time or just come. Some people like to come and just listen and learn that way of hearing other people's projects. We are in talks with members of the CTSC for planning a third annual Big Datathon. This typically focuses on Cosmos Big Datathon, and this will take place in quarter 4, so closer to the October kind of fall term timeframe. So the date and concentration for that are to be determined at this time. But just so that you have these events on your radar, we're doing a lot, and we encourage you to do a lot as well with the CTSC in relation to big data. So, TriNetX database query refresher. This will cover, we've had TriNetX beginner, TriNetX intermediate, and then of course our first analytics. So this has some analytics information included. A quick reminder that TriNetX, unlike Cosmos, is actually a combination of different types of data sources. So you have different types of measures available to you that would not necessarily be available within the Cosmos platform. It's not just about electronic medical records. You also have medical claims and pharmacy claims. You can also look at some cost data. There are also different network types that you can look at to see what types of healthcare organizations you might want to query within a network. Um, and there are different, again, different types of data that would be available to you in TriNetX versus Cosmos. If you're interested in getting a refresher on any of the TriNetX database webinars we've done in the past, they are available through CTSC's website. This is a direct link to the beginner webinar if you need any refresher on performing queries, because performing queries are essential to do and do correctly before we get into analytics to make sure you're actually isolating the characteristics of your cohort of interest that's relevant to your research question. Um, Unfortunately, people at the Cleveland Clinic, currently TriNetX is not necessarily a pay-to-play platform. However, they make their data available to sites that contribute data to them, similar to Cosmos. So at the moment, you would need an affiliation with university hospitals, or Metro Health in order to gain access. So assuming that you are affiliated with one of the two, these are the direct ways that you would go about getting access if you have not done so already. As I mentioned, you can get access to the intermediate as well as our first advanced webinar through CTSC. We've talked more about queries and data visualization as sort of an initial starting point for getting into analytics. And we've been running, if you've attended our webinar series in the past, we've been trying to keep a consistent sort of research question in looking at hypertension, like getting a hypertension, looking at patients with a hypertension diagnosis. And previously we've looked at those, done some comparisons to see, people who have hypertension, what do their outcomes look like versus people who have hypertension who are on an antihypertensive medication and doing some comparisons that way. So just also a refresher of what some of our research questions go into. This is the query platform, how you actually have to establish your cohort definitions. It's always through queries, and you can group your terms in a query. It's a little misleading, that information, because you actually need to define queries by their groups by their queries for cohort comparison, and groups in TriNetX just simply means ways to group and organize your query terms. Comparing two cohorts, we spoke about this last time, and how you can also use some of the embedded analytics to do propensity score matching, and we spoke about some limitations related to that. So what we're kind of using that to segue to our first analytic topic for today is advanced cohort exploration. So when we were working with propensity scores, just trying to build off of what we did in our last session, our last webinar, is that we did propensity score matching based on Black or African American. We actually did a couple of different things to help narrow the scope and better define our cohort before we were really able to include propensity score matching in our analysis. So what we're talking about today is just another way of better understanding and analyzing your cohort of interest. And what's neat about working within TriNetX, especially within the advanced cohort exploration, is it gives you, you can look at what we're going to be talking about today is other ways that you can look at your cohort over time, other ways that you can manipulate what TriNetX calls the index event, or sort of an exposure variable that you can use to simulate a more of a retrospective observational study, and just some of the different comparison tools that are available to you comparing cohorts over time and better understanding your topic of interest. So with this, we're going to go into our modified research question, which I modified specifically so we could look at a time-related question in a couple different ways. So we're still drawing on the basic research question of trying to understand, who in the cohort for adults in the US who have a hypertension diagnosis, how can we better describe some of the differences in their diagnoses, their characteristics, their known risks, and just better understand them in general. So one drug that has, or really set of drugs that has gained a lot of attention in recent years is the introduction of clearance for GLP-1 drugs, and how the GLP-1 agonists were approved for as a weight loss medication rather than simply a diabetes treatment. And so uh, the more we're really interested in kind of modifying and looking at this in a couple of different ways of better understanding the characteristics of adults with essential hypertension, narrowing our cohort to looking at just those who have been prescribed an antihypertensive, and looking at sort of in a pre-post fashion people who were receiving a GLP-1. So with that, I'm going to turn it over and we're going to do a live walkthrough, a live demo. And I have some of these as you may have seen. And if you are someone who works within any of these platforms, you know that they do the queries in real time. And so that does mean that they are um, actively applying your criteria across millions and millions of patient records every time you hit run. So I have some of these pre-worked and, time allowing and internet bandwidth and the platform allowing, we can modify some of this to look at it in a couple different ways. Because there are a few different ways within TriNetX that you can try to get at answering this specific question. So everything, as we mentioned, kind of boils down to your queries and how you have them built. I'm just in my TriNetX kind of going back to my studies. This is your landing page. Um, you select your project of interest. So in this case, I'm going to select Big Data Advanced. So in order to create this query, I did need to include some characteristic of GLP-1. So in this case, you may remember from our first and second webinars that there are a few different things that you can do to kind of look at this in a few ways, that you can specify age ranges. You can also specify your data source, whether it's something that's defined within the electronic health record as a discrete variable or something that was extracted from free text using natural language processing. So I created this query simply by going to one of the queries and cohorts that we had defined previously of hypertension with treatment. So I copied that query over and added and must have a GLP-1 um, uh, having been prescribed to them. So that's just showing how we went about doing that. Um, I renamed this so that it would be saved as a separate cohort, because when you import a query, it will sort of, and really before you run a query, it will sort of save it. I'm seeing if I can find an example. There are some here that are unnamed, that you might see the right-hand side of my screen. And so if you sort of save it as a draft, it's not really anything. You can have an unnamed uh, query or unnamed cohort, but if there are no patients or HCOs, you can even have a named one, but if there are no patients or HCOs underneath it, you're not going to be able to use it with an analysis. So you have to actually like make sure that you run the query before you're able to do anything else. We're getting a snapshot here of the fact that we have 337,000 patients out of a potential number of 157,000, and that not all healthcare organizations have patients that contribute data that meet our criteria. So, you can jump over here. You still have the same explode core cohort. Um, you can still explore. I'm not going to run this in this area right now because we are more interested in looking at advanced ways of looking at the cohort, but you still have all your typical ways of exploring a cohort, looking at their diagnoses, oncology, procedures, medications, labs. It can be really important that you look at that simply so that you can ask yourself, is this the query that I intended to run? Have I included all criteria that may help signify the patients of interest, or is there something that's standing out to me that signify an error? And so I do encourage you to go through and look at these. I'm going to go down here to our analytics, which is where we're spending most of our time today. And so whenever you run a new analysis right? So I can actually access, our previous hypertension comparison example and how different, how we ran this in the last webinar. Um, and you can give your analyses name. So I didn't give this one. I can give this one a name. Go into it. You can select, any of the cohorts. If you were on the landing page and this was the first time that you were running this analysis, you go under new analysis, and this gives you all of your potential ways of looking at your data. So you'll see here that Advanced Explorer cohort, it kind of gives you some nice high level information that you need to make sure that your analysis is appropriate to your question and the number of cohorts that you've defined. But right, in this case, it's a single cohort. We're exploring characteristics and potentially exploring some outcomes. And we're actually going to be looking at this across different time periods. So I'm going back to my analyses. Don't really want to spend the time today like rerunning what we've already run. I'm going to take this analysis. We're going to go to characteristics of this cohort. And so there are a couple of ways that we can look at this, and it may require me to rerun this in real time. So I'm going to go through the time period first, and then we'll go over the index event. So you'll see here that you can set a time window, and this could be in relation to when something occurred. So in that case, there's an index event, and you can say, I want to look at someone's maybe I'm looking at GLP-1 in my hypothetical example when I'd use more of a relative or a set time window. Maybe I want to see what their hemoglobin A1C looked like 1 year before being prescribed a GLP-1 classified drug versus 1 year after the prescription. And so I could set it in relation to a drug therapy, really anything that I wanted to define as an index event. It's pretty intuitive to use of like anytime before 6 months. And, just because you said 6 months doesn't limit you to that. You can include everything within that time period. And then you would just need to say, okay, all right, maybe I don't want same day, but then after I'm going to do, I'm going to do 1 year, right? 1 year after, right? And then it sort of specifies my time period here. Um, but for this, we're going to look at fixed times only because we know that in 2021 is when this approval took place for GLP-1s. I have my index event set. For they need to have also been prescribed a GLP-1. And I hope that I don't have to run this. I think it should already be okay. I think we're gonna have to run it real time. So it'll give you a nice indication of how long it's taking to complete your analysis. And I think one of the tricks when you're working within TriNetX is to make sure that you're staying active within that tab, not necessarily because it takes a long time to load, but to make sure, even though this is a expertly de-identified data set that really cannot be re-identified, for security reasons, you can get logged out pretty quickly, and it does require dual authentication. And so, if you get logged out because you're like, okay, I'm going to wait for my analysis to run, let me go work on something in my other screen, you just want to make sure that you're revisiting it to make sure that it's properly loading and running the analysis that you wanted. Are there any sort of like questions or like comments so far while we're waiting for this to load?
Do you mind I ask you a question?
Yeah, go ahead.
So, I have access to TriNetX and I'm actually working on multiple projects, but the issue is I don't have access to the Advanced Explorer course and also the Cox proportional hazard model and also the competing risks. So, how I can get access to those? Should I like request to anybody?
And which institution are you with?
and with UH.
UH. So I think we can pose that question to Dr. Jarrett. And we can put that, if you don't mind putting that in the chat, so we can make sure that that gets
Sure.
directed to him because he's also at UH. So I mean,
Okay.
that should be, but so when you go to your analytics, it shows everything else.
Yes, I have access to other five, but these three are locked for me.
Um, I'm just gonna take a quick look. But I'm guessing that you don't, and you have more than one cohort defined. I mean, you said that advanced.
Yes.
Okay.
Yes. So in the analysis, when you're going to choose your type of analysis, so these five has been always like locked. It doesn't matter like how many cohorts I have, like or I made. The issue is these are locked. These are like separated from the top ones.
Yeah, I've not, I mean, each institution can toggle what they make available and why. This is the first that I've heard of that at UH and in general, because
Mhm.
really it should let you, even if you don't have enough cohorts set up, like for like say that you've only identified one cohort, maybe you accidentally grouped your terms and thinking that you could do comparisons based off of that when you really needed to create two cohorts for comparison, it should still let you into the analysis. It just, you wouldn't be able to move past that screen because it has a place for you to select two cohorts.
Yeah, yeah, I know what you mean. That's like even if I'm going to like compare outcomes, if I don't add like two cohorts, I cannot move forward. But they still, those are not locked, so I can choose them. But these three are locked, so I cannot even open them.
Yeah, that can you I don't know if is it Dr. Naji? Is that your name?
Yes,
Okay.
yes.
You can put that in the chat and we can direct Craig to help troubleshoot that question.
Okay.
And I don't know if we it sounds like it could be a quick fix. I would hope it would be.
Okay, thank you so much.
Not a problem. So this is going to first generate our demographics and we can look at characteristics. You can, if you're noticing something that's interesting to you, just like with any of the other analytics that you can do, exploring cohorts or comparing cohorts, you can go through and sort of flag potential demographic information you want to look at later or explore further by just hitting the save. Anytime you hit that button, it'll pop up over here under saved characteristics. So you can look at that more explicitly or more closely under saved characteristics. So this will be an interesting one because at least what I was noticing with this earlier is right when we were looking at because I ran this in two different ways that I'm hoping to be able to show this with you to explore GLP-1s. I just at first looked at the index event of looking at this following the same set of patients, looking at their outcomes before and after being prescribed a GLP-1. um, and you can do that. We can do that together. But in that case, you're going to find that when you go to diagnoses, right, because of when GLP-1s were approved for late weight loss, that you're going to have far more people show up under having, endocrine issues. Is going to be about like nearly 100% of your cohort. This you just see a little bit of an uptick of people who probably were receiving GLP-1s for weight loss. And you can, like with anything with exploring a cohort, you can drill down further to get, past TriNetX sort of really high level groupings to get into more specific diagnoses or medication or even genomic differences that might be of interest to you. So again, you can save as you go. This is really more, right? As it says in the term, we're not really doing this we're not really using advanced explore cohort to compare cohorts I mean, you can use it to look at outcomes but it doesn't really come with like a set of inferential statistics that you can um, report in a paper. So interestingly, I don't know how interesting this really is, but we have there are very, very low ends, the number of patients, but you have almost no one who has a history of cancer um, in this. And so, if you're someone who maybe that opens up another question for you, if, does GLP-1, by reducing obesity, does that lower risk for certain cancers? I don't think that this is enough data to really even open that research question, but I just know that that has been of interest to cancer researchers, that particular question. But right, you have access to procedures, medications, and anything that you might want to explore. See how long this takes, and then I'll try to run the analysis the other way so that you can just see kind of the difference of looking at this with a hard time period. Again, we're only looking at the time period from 2021 to present for this cohort of patients who are prescribed a GLP-1 within that time period. Right? You're able to get into all these other characteristics. But we can also maybe look at the question related to GLP-1 in relation to when they received a GLP-1 diagnosis. So I have this, set from 1 year prior to 1 year after the prescription. Because we're looking at relative times, we're going to say GLP-1 is our index event, right? And then we're going to run the analysis and hopefully it will come up. But while we're waiting for this to run, I hope that the different ways of looking at kind of a similar question make sense of how you would do that, or how you could do that using advanced cohort. I haven't seen too many studies published using advanced cohort exploration. It's just sort of a nice way of taking a deeper look into the cohorts that you're defining, or cohort that you're defining for your research question. But are there any additional questions right now while this is running?
I have a question about this advanced cohort. And that is, can we like look at, can we match the cohorts and look at the events that are happening before our index event? Like maybe lab values before our index event?
Yes. I mean, so the thing is, you would only be able to do that really like one cohort at a time.
So we cannot match cohorts, right?
Well, you can do the compare cohorts if I'm understanding your question correctly.
So I want to compare my cohorts with my controls, and I want to match them for age and sex. So I want to see, can I look at any kind of events before my
All
index?
right. Are you
Um,
all set, Ashley? Are you going to let it
Not
run?
quite. No, we're just there was a question that is specific to UH. Dr. Naji mentioned not having access to some of the analytics in TriNetX. And so that seemed like a fairly specific problem. I'm just running one more example of kind of looking at how you can specify your index event, uh, either relative to an event or for the time period versus looking at an absolute time period.
Okay. I'm happy to take over if you want to let it run, and then we can go back to it. Regarding the analytics, you may want to so I would contact, it's just biostats support. I can throw it in the chat at UH. Here we go. Biostats support at UH hospitals.
And then Dr. Naji was also asking a more specific question about, I just want to make sure that I understand the question, that you're trying to run cohorts, that you're trying to compare them before and after a specific event.
Yes, I want to see like if we can look backward, like um matching two cohorts and look at the events before our index.
So, so do you want to
Yeah.
go to the, that's
And you
all
only
the
want to look
code.
at before the index, right?
Yes,
Yeah.
like
So
at
you
time
would,
points before the index.
hmm So that would just be, so you'll see here, and I just wanted this for illustrative purposes, that there's a slightly higher number of people when we expand our time to be relative to the event, a slightly higher number of people with diabetes and metabolic disorders. But yeah, it has to go, I think your question has to do with like looking at the index event. So you would just right up to the index event, you would just have it be, you would have a relative time window. You would set your index event down here, and then you would just say however long you wanted to compare cohorts. This is the wrong this is not the analytic window that you would be in. You would be either I think you would be in compare cohorts for that.
Yeah, so you need a two cohort. So it's to compare cohorts, but it's the same interface. You just move you put your index event and like Ashley's showing here, you go before instead of after.
Hmm. All right, Craig, I'm going to turn it over to you. Does that answer your question, Dr. Naji?
Um, yeah, and I want to know, like, can I like match my cohorts for this?
You can match them based on using propensity score matching.
Yes,
But
I mean, for looking backward, I still can match them, right?
yeah, but you have to be within the compare cohorts to do that, and you have to specify your time window. Um, but yeah, you can do that.
So for compare cohorts, when you're going to outcome, you can just choose the time that is after your index event. You cannot choose your outcome before that. That's my issue.
Yeah, so you have to be in a two cohort. And if you think about what you're trying to do is you're trying to match the patients. There is it depends on what your index event, what you're calling it, right? So if you're trying to
Mhm.
match your patients at the index event and look backward versus matching a patient's at some specific time point and then looking forward and waiting for that index event, that's not your actual index event. That's then your outcome. Does that make sense?
Yeah, I got you. But the issue is, so if I have a certain index event and I want to look at any time before that to compare for multiple things, so I cannot look at that, right? I should get the data for that. I
So
don't know if
maybe
I.
we can get into the specific research question to look at the nuance because it's really you need to be in a two cohort model, right, where you can do the propensity matching. And
Yes.
like you said, you can only look forward in that. But you're matching at the time point zero and looking forward for something, rather than having an index event and looking backward. Because if you have the index event, like where are you matching the patients? At the time of the
Mhm.
index event or sometime
Yes.
prior to that?
Yes, at the time of the index event.
So you're propensity matching at a future state and you're looking back at patients, what happened to them prior. That's usually not the setup for propensity matching, but we can I think we're just once we know your specific research question, I think it would be helpful. Um,
Yeah.
so we have a
Uh,
little time at the end buffered in, and then we also have office hours, which is a good time to come with like your individual research specific questions.
Okay, sounds good. Thank you.
You're welcome. So I'm going to move on to treatment pathways, which is a feature in TriNetX that allowed you to look at what happens to patients after whatever you define. So whatever your index event is, you can look at what happens thereafter. And so the research question we had to change a little bit for this, and again, this is just to show an example, but for this purpose, the question is, what are the differences in treatment pathways for PCI, which is percutaneous coronary intervention, versus coronary artery bypass grafting surgery, which is CABG, in patients following acute myocardial infarction? And specifically, what are the differences in percentage? Like how many patients have CABG versus PCI? Is there crossover between the groups? A failed CABG having PCI or a failed PCI having CABG? And then when do those times actually occur? So I'm going to show one slide here that's this kind of new, it's a, I think very specific to TriNetX, but it's important for you to realize otherwise the lines of treatment don't really make much sense. So what this is the actual interface, and I'll show it too in the live demo. But what you have to do is you have to determine what you're going to consider, your crossover event, how long that period is, if the patient dies, what happens. And so that is all in this interface. And I wanted to just show it and go through it quickly. But so you have to define the criteria here. And as this says, the first line of treatment starts on the first day a patient receives a treatment. So if you have an index event like an acute myocardial infarction, the first line of treatment is going to be the first from that index event. There's going to be a time period before that treatment. That line of treatment is the start. That is the considered the baseline treatment, if you will. And then unfortunately, this is it's a defect in the data, not really TriNetX. The data is day-based. So if you have a patient, if you can just walk through this process, has a myocardial infarction, let's say at 1 a.m., gets to the hospital, they undergo PCI, which is the stent. And so door to balloon time ideally is less than 90 minutes. So pretty quick, right? And so have a stent, let's say that's a failed PCI. They dissect the artery, they can't open it. That patient then goes on to emergent or urgent CABG that same day. That patient is considered PCI because that was the index treatment. Uh, but then that CABG is missed. So because the line of treatment starts with that index treatment and it lasts 1 day. And so again, that's a defect in the data. The data does not have the hours and minutes that procedures occurred. It really just has the day. And that's mainly it's a billing issue, right? And so uh, insurance companies, payers don't care what time of day. It's like, okay, you had a procedure on this day. And so that data is lost. And so it kind of makes these little nuances important. It could be important. It's a fraction of patients that would occur in, but again, it's just something to keep into account or take into account. You can also change if a patient dies, what happens. Again, death data in TriNetX and Cosmos is not good. It's really only in hospital death, which in this case, for this research question would make sense. Um, when a patient's medical record ends, so even after a patient dies, there's still going to be things put into the record. And then your analysis time window ends. So I'm going to pick, you know, within basically 30 days for this, what happens. And so that is important to know. It'll make a little more sense when I show the picture. Although I think this specific lines of treatment picture is not super helpful. So I'll jump into the live demo, log in here. Okay. So let me take a step back here. I kind of worked through that quickly. So again, you'll have, this is a saved analysis for me. You can, of course, make a new analysis, and I'll show where that is. It's conveniently called treatment pathways. Again, this is the distinction. It's a single cohort model. And so you look at your index event, you can review characteristics before the patient has the index event or after, but it's still the single cohort model. And so I'm going to cancel out of here, or the one I already have saved. And I've already done the query. The query is very simple. It's and we don't have to go through it because we've done now three prior TriNetX, and Ashley also kind of showed this. Creating that query, it's just patients who had myocardial infarction. It's the broad category of myocardial infarction, acute myocardial infarction, not a history of myocardial infarction, and patients who are over 65. So that's it. No exclusions, very simple. Again, if you were doing this for a real research study, you would want to be a little bit more sophisticated with that approach. But to get it to run quickly, again, I just went with this. So here, the time window that's currently listed for the myocardial infarction is really any time um, in the any data in TriNetX is available. Um, we'll go to the demographics screen. These are the same screens as before. And so there's no difference. It's the same look, same feel. So it gives you the demographics, diagnoses, so you can kind of pick through again, and you have the opportunity to save these, which will then show up in your saved characteristics if that's what you would like to do. Um, so same interface. I don't really need to spend much time on this. This is a new now kind of interface where you can look at the different treatments. And so for this specific question, I went out 90 days. I think it was the other question I had 30 days. So what happens within a 90-day window? Again, for this, you could run 30. You could even probably run like 2 weeks. There's going to be some patients, um, that unfortunately have an MI and are still in the hospital at 2 weeks. But you can again play with that. It's very easy. Here are the criteria. There's only one index event in the query that I made. So of course that has to be the index event, which is the AMI. And again, you cannot set an index event on something like age, right? So that's actually grayed out, which is helpful. Um, procedures. We'll just go to save treatments. So procedures has the same. This was run, and I'm not sure why it's showing as unrun. Um, but it shows you the same interface that we have for everything. It's actually the same interface with just procedures. So based on CPT codes, and here's a good example. And so I've already went through and I've put in kind of the ones that I thought were interesting, which these are based on CPT. So CABG, so coronary artery bypass grafting, you can do it with just arteries, or you can do it with arteries and veins, or you can do it with just veins. But these are the CPT codes that capture CABG. There's a cardiac assist procedure, which is if you have a heart failure and you need some sort of either an external or internal pump to help. I didn't actually look at that in detail because the query was timing out, unfortunately. And then this PCI said whether a patient had a stent or not. And unfortunately, okay, so this looks good. And so here are the once you pick the treatments kind of interest, you go into pathways and you look at your the inputs is this interface here. Again, we've set the time window that we're interested in. Uh, we've already determined this in the prior window. It's just showing it kind of again. And this is where you can kind of create your groups just as you would with any other uh, query. And so I'll just show you where that ends up so it's a little bit easier to see how I did this. But you go under save treatments. These are again the ones you starred from this tab. They show up here. You can do select all. I'm going to cancel out, but you can see it would just drop all these in. I cancel out because I don't want to think this is a new query and not show me my results. And then creating a group. And so it does not allow you to do and logic here because that would be really confusing. So the group is you can have this or this, not this and this. Um, and so I defined a cabbage group and a PCI group, a stenting group. And then this is that picture I showed before where you define the criteria for the lines of treatment. These are the default settings. I'll show you what that looks like. But again, if you look here, there's days, weeks, and months. There's no hours or time of day type situation. So you have these little nuanced cases where if it happens in the same day, it's only going to capture that first event. It could be important for this research question. I think it is important. That's not uncommon. Again, it's rare to have a crossover event between PCI and cabbage or cabbage and PCI, but it does happen at like a rate of probably 1%. So then you click run. I already clicked run, and you get these results. And so this is where the lines of treatment get a little bit confusing. But they're very good. So if you click either of these question buttons, it will take you to uh, help kind of FAQ, uh, like what does this mean? Learn more, and that's pretty helpful. It's also helpful just to play around with it. But according to this at this you first look, um, you can have patients who have cabbage or PCI. So the pipe is a or. And so it looks like the vast majority, so about 75%, had PCI following acute myocardial infarction within 90 days uh, of the patients who had a treatment. And so that's important to realize. And so it's very small up here. Um, it's not there. So it's here. So 1.4 million patients or 91% of the cohort didn't have a pathway, meaning they did not have a treatment based on what I defined. So these are patients who have either a small infarction or they were treated with medications, so fibrinolytic therapy rather than having a stent. Um, maybe it was the the myocardial infarction was um, the time window has already passed. And so there's a bunch of reasons that patients wouldn't have one of these two procedures. And again, over 90% didn't. But out of the 10 or so percent that did, 75% of those had a stent, and then about 25% had a cabbage. We're still talking 30,000 patients and 105,000 patients, so it's a lot. And so you see the PCI patients enter here. This is the line treatment one. So again, it's 75-ish percent. Um, the cabbage patients enter here at 25-ish percent. And then out of the patients who had uh, another treatment, which would be, we only listed two, so it's PCI going to cabbage or cabbage going to PCI. This is the breakdown. And this does not mean, and this is what is super confusing about this picture. It does not mean that out of the 20% that had a cabbage, 70% then went on to have PCI. That would be a disaster, right? It just means out of the patients who had a second treatment, more patients had cabbage than had PCI. Really confusing. This graph, I think, doesn't do it justice. I think a better graph would be, let me flip over a better graph would be something like this, which is an alluvial plot. You can actually see patients, the flows of them. This is from a study we did looking at patients who are on having heart transplants, what their status is. They start as status 4 and they move into different statuses. So I personally think that would be a better use. But this again, it's really confusing because it does not mean that 75% of patients who had cabbage went on to have PCI. It just means out of those. And the next picture will show that. And then strangely, the last line of treatment, some patients, at least a small percent of patients, ended up having a second event, a third treatment, I guess. So that's very strange. And so here is this gets into a little bit better, and you can click on it. And so again, index event. I can't hover it, but index event and then cabbage. So arrow makes it very clear, 22.6% of patients. So index event and then PCI, 77.3% of patients. And then if you look at these, this is where there was that crossover. So you had a patient had a stent, probably failed, maybe dissected, patient still having chest pain or still having infarction despite PCI, then they go on to cabbage. It's listed here as 0.7%. The literature suggests it's closer to 1%, like all the big studies. And so this is probably those patients who were missed, right? Who had the initial PCI and had a cabbage within the same day. Those patients do not show up here, and they should. But again, the larger data that's from multi-million dollar trials or single institution studies, which make it very different. And then lastly, I'll show the lines of treatment. And I think just to slightly digress here for a second. Um, you'll see some of the rawness of TriNetX. So, and unfortunately, um, you really have to be careful because you could do do all this and don't take something into account, and the numbers show up, and you're like, here are the results, and you missed something very, very critical. And I'll show you, this is a good example. So if we pick patients who had that index event of having a PCI, it will show us things like time to treatment. And this is an example of where you really have to have a statistician involved still. You can't just do this or it's just not going to be as a good of a publication, um, or the people looking at your abstract or manuscript are should be bringing up these points. And so this is a perfect example here. The PCI, so most patients have it within the first day, right? We went out 90 days, I think. Again, you could crunch this down to 30, your picture would look a little better. Um, but this is important to note. This is right skewed, right? This is not a normal distribution in any sense of the word. Specifically, it's zero censored. So you cannot have, right, the event, we defined it as such. The event happens after the diagnosis. So PCI happens after the heart attack in this study this data. And so this is right skewed data, zero censored data, more importantly, and they're giving a mean, right? So this is statistically garbage. So you just have to be careful, when you're reporting these, you don't report a mean on right skewed zero censored data, right? You should be reporting maybe a median, because just think of one patient out here, right, who had a time to PCI of 2 months. You're putting that in now and you're averaging it with patients, right? Makes no sense. And so just be careful, still keep your statisticians involved when you're doing these studies. The time on treatment, this again is very unique to TriNetX. You don't typically see these types of plots, right, in many studies, but it goes through each. And so the number of patients, the mean number of days be before, when they had that um, time on treatment. And so again, and then it shows you, and time on treatment specifically just means from the time, right, they had that index treatment to the time the study ended. And so um, you can see that it's about 75 days. Um, we set the we set it at 90. And then there are a fair amount of patients who had in-hospital deaths, which are recorded here. And you can see those pictures as well as kind of a survival plot. And these are nice in the sense that you can, again, it looks so close. You can start to see these by unchecking and checking. Um, and so that's time to treatment. Time on treatment, again, if you're interested in having what happens with a patient after a specific diagnosis, you can try time to treatment, a good taking into account those nuances. And then we'll just take a couple quick minutes here and do competing risks. This will be a quick one. Um, for this, I'm using the same query, right? This is the query we have saved. This is MI in patients who are 65. Same characteristics, right? You set your index event. You can't set age. You can look at diagnoses and all these other things. Um, you can then, that is again to get a sense of you're basically describing the population, and does it have the sufficient numbers of events that you need? Um, you then can explore outcomes, and you use this when you want to look at a patient developing an outcome over time, and then looking at, are there risks, um, what is the risk of developing a complication from from a treatment, or from an event like a myocardial infarction. So I've already done that. I picked through, I can definitely show you kind of what that looks like. And it's the standard drop downs. So here we go. And so they break it out down into, for this, since we're looking at diagnoses, ICD-10 codes. And so you simply, and again, you'll realize it's the interface is doing its best, but There's just so much data. It takes a minute to pick through these. And so the standard kind of drop downs with parent-child relationships, you can star them, and then that becomes one of your saved outcomes. And so I've already done that. I want to look at patients. The research question here, I'm not going to flip back to the slide since we're kind of running late, but is in patients who had a heart attack, acute, not a history of, but who've had the heart attack as the index event. Uh, what is the likelihood they're going to develop acute kidney failure, influenza, pneumonia? That really probably should just be pneumonia. Again, you can refine that by using a child of this ICD-10 code, which would be like, J17 or just for pneumonia or whatever it is. And then same thing about the cerebral infarction, so stroke. So after an MI, what is the risk of developing AKI, pneumonia, or a CVA, a stroke within 30 days? And so say those outcomes, then you go to your competing risk, you put in those inputs. It's very similar to the treatment pathways. Again, I have those saved. You can select all and it will drop them all three in here. Ugh, that's a that's a good gotcha there. Uh, as you can see, you can actively be using it and it will just boot you out. That is kind of funny. Here we go. Wow. Okay. Back to that screen. So saved outcomes, select all, add, and it will drop them here. So now we're going to look at each one of these individually. If you wanted to create a group, a composite, and I'm not going to do it again because the moment you change something here, it thinks you're changing the query. Even if I change it and delete it, it's going to have me rerun it. So I'm going to leave this as is, but you create a group. Like, let's say you want to look at the composite. This is one thing we do in cardiac surgery all the time. What is your risk of kidney failure, pneumonia, sternal wound infection, uh, or death, or a composite of any of those, right? And so that's where you can just create a group, and you can create a group with all your the summation basically of having those, because it's not like you can simply just add these together, right? Because a patient could have both. And so that's important to note. And then the results here are very straightforward. It just gives you the percent of the cohort that had that event, meaning patient who had an MI who subsequently went on to have acute kidney failure, and then the cumulative incidence at the end of the time window, right? So you can look these. These should be pretty close. If you like for instance, if you did it here, and these are very different, maybe then you should, and you can look at the plot too, that you can see that, they're pretty much leveled out. And that's what we only go in for, these events, and clinically we basically at the time of, other than death and sternal wound infection, it's at the time of hospital discharge, not out 30 days. And so again, you can get creative with this. You can combine these all into an all category. Again, very straightforward. So with that, we have 1 minute. I can go over a couple minutes if there's anyone who has questions. All right.
Well, thank you guys, and we appreciate your time. And I will be sending out the recording to those registered, and we'll be putting it up on our YouTube as well.
Great. Thank you.
Thanks, Laura.
Guys.
Thanks.